Assalamu alaikum, everyone. Today we will be touching on the topic homosexuality. As we know, homosexuality, how it's being viewed and stigmatized globally. But today we will be looking at homosexuality in ancient Greece as compared to the 21st century. We're going to be also touching on how it relates to the mental health issues of a lot of these, the LGBTQ community, and how the impact of it. But for this week's presentation, it will be focused on two areas, being homosexuality in ancient Greece as compared to the 21st century, and also the comparison between ancient Greece and the 21st century, the differences and the similarities. So to begin with, homosexuality is a romantic attraction, sexual attraction, or sexual behavior between members of the same sex or gender. As a sexual orientation, homosexuality is an enduring pattern of emotional, romantic, and/or sexual attractions to people of the same sex. It also refers to a person's sense of identity based on those attractions, related behaviors, and membership in a community of others who share those attractions. Psychology was one of the first disciplines to study homosexuality as a discrete phenomenon. Prior to and throughout most of the 20th century, common standard psychology viewed homosexuality in terms of pathological models as an illness. That classification began to be tested in research, which has now produced strong empirical evidence regarding homosexuality as a disorder. A large number of professionals in medicine, mental health, and the behavioral and social sciences sit on the fence regarding the classification of homosexuality as a mental disorder. In most recent years, many have claimed the conclusion as accurate and that the DSM classification reflected tested assumptions that were based on once prevalent social norms and clinical impressions from official samples, which consisted of patients seeking therapy and individuals whose conduct brought them into the criminal justice system. The view of homosexuality as a psychological disorder has been seen in literature since research on homosexuality first began. However, psychology as a discipline has evolved over the years in its position on homosexuality. Current attitudes have their roots in religious, legal, and cultural underpinnings. In the early Middle Ages, the Christian Church ignored homosexuality in secular society. However, by the end of the 12th century, hostility towards homosexuality began to emerge and spread through Europe's secular and religious institutions. There were official expressions condemning the unnatural nature of homosexual behavior in the works of Thomas Aquinas and others. Until the 19th century, homosexual activity was referred to as unnatural crimes against nature, which we refer to as sodomy or buggery, and was punishable by law, sometimes by death. As people began more interested in discovering the causes of homosexuality, medicine and psychiatry began competing with the law and religion for jurisdiction. In the beginning of the 19th century, people began studying homosexuality scientifically. At this time, most theories regarding homosexuality as a disease, which has a great influence on how it was viewed culturally. There was a paradigm shift in the mid 20th century in psychiatric science in regards to theories of homosexuality. Psychiatrists began to believe homosexuality could be cured through therapy and freedom of self, and other theories about the genetics and hormonal origin of homosexuality were becoming accepted. There were variations of how homosexuality was viewed as pathological. Some early psychiatrists, such as Sigmund Freud and Havelock Ellis, adopted more tolerant stance on homosexuality. Freud and Ellis believed that homosexuality was not normal, but was unavoidable for some people. Alfred Kingsley, research and publication about homosexuality began the social and cultural shift away from viewing homosexuality as an abnormal condition. These shifting viewpoints in the psychological studies of homosexuality are evident in its placement in the first version of the Diagnostic Statistical Manual, which is referred to as the DSM in 1952 and subsequent changes in 1973, in which the diagnosis of ego dystonic homosexuality replaced the DSM-2 category of sexual orientation disturbances. However, it was not until 1987 in DSM-3R that it was entirely dropped as a mental disorder. We will now look at a comparison between ancient Greece and the 21st century in terms of its differences. So we'll start look at its differences now. So religion being the first one. In the 21st century, the relationship between religion and homosexuality has varied greatly across time and place, within and between different religions and denominations, and regarding different forms of homosexuality and bisexuality. Present day doctrines of the world's major religions vary vastly generally and by denomination on attitudes towards these orientations. Among those denominations that generally are negative towards these orientations, there are many different types of actions they may take. This can range from quietly discouraging homosexual activity, explicitly forbidding same-sex sexual practices among adherents, and actively opposing social acceptance of homosexuality to execution. Religious fundamentalism has been found to correlate positively with anti-homosexual bias. Religious are richly varied in their organizations, belief system, rituals, and practices. This is true across cultures and history. Grand statements about what all religions say or believe about anything, especially about such a complex phenomena as human desire and sexuality, are not just unhelpful, they are impossible. Nonetheless, this has not prevented many Christian opponents of homosexuality from asserting that all religions condemn homosexuality. This assertion is patently false. It is not even the case that all Christianities condemn homosexuality. The myth that all religion condemns homosexuality passes off one strand of Christian interpretation as a universal moral claim about what all religions and all religious people believe. In fact, what religions have to say about homosexuality varies considerably, not just among religions, but within religions too. In ancient Greece, religion was not this diverse, therefore making it not effective when debating homosexuality. Culture. In the 21st century, homosexuality is more accepted in first world countries than in third world countries. However, in ancient Greece, it was accepted generally because men were superior to women. The men were attracted to knowledge, and in that era, only men could be educated, hence leading to the formation of romantic relationships. In ancient Greece, homosexuality was more common among men. It was mainly between teachers and students, adult men and adolescent boys. In the 21st century, this would be considered against the law, and homosexuality is prevalent among both genders and all age groups. Fashion. In ancient Greece, it was never easy to distinguish who were homosexuals because they dressed according to their gender, meaning that males dressed as males and females dressed as females. In the 21st century, it is easy to distinguish and sometimes hard because homosexuals cross-dress and even have cosmetic surgery to do same-sex changes. In 21st century, technology has allowed homosexuals to undergo surgical procedure to change their sexes, whereas in ancient Greece they hadn't such technology. In ancient Greece, men had wives and children and were still attracted to men. In the 21st century, homosexuals have families according to their sexual orientation. In the 21st century, homosexuals are supported by human rights services and they have an LGBT, lesbian, gay, bisexual, transgender communities worldwide. In ancient Greece, there was none of this. Homosexuals are faced with psychological disorders due to discrimination and stereotype in the 21st century. However, in ancient Greece, this was not as prevalent. Women gained rights in the 1900s, and only then were they allowed to be expressive about their sexuality. In the 21st century, there are countries that allow same-sex marriages. In ancient Greece, there was no sex marriages. Homosexual males are considered commercial sex workers in the 21st century. On the other hand, in ancient Greece, women were mostly seen prostituting. Homosexuals in the 21st century have advocated for their rights, and in ancient Greece, they were not expressive. In the 21st century, there is prevalence of sexually transmitted infection and disease among homosexuals, which did not happen in ancient Greece. In the 21st century, the intolerance level of gay bashing is so high and violence against homosexuals which were something that did not happen in ancient Greece. Homosexuals are revealing their identities to their families, friends, and dear ones, as compared to ancient Greece, of which this never happened. It was more kept as a secret. In the 21st century, homosexuals are stereotyped as weak and effeminate, and female homosexuals are stereotyped as masculine and aggressive. And in ancient Greece, this did not occur because men were seen as superior to women. Therefore, regardless of being attracted to men, they were still seen as masculine. So we'll stop here for this week's presentation, and next week we will continue on the similarities, and then we will go on to the mental health issues that there is a spill off to it, and talk a little about suicide as it relates to the stigma attached to homosexuals and them not being able to come out and reveal their true identity as we speak currently. Thank you.